Ladies and gentlemen, welcome back to another episode of the Diary of a Trainee Psychological Wellbeing Practitioner. Diary of a Trainee PWP. All right, it's evening time. I'm a bit tired. It's just been, trying to get the bus on a weekend is a bit of a tough one sometimes, especially when there's delays. But anyway, this episode is episode 9, all about week 9. And this was one of the quickest weeks I've ever experienced. Quite interesting, to be honest. And it was us reaching near to 3 months. We'd completed 2 months. We're on our 3rd month. And myself, as well as all the other classmates and colleagues, we're all mutually struggling, or we find it challenging to fit. We're juggling between two different diaries, 2 different schedules, 2 different timetables, or we've got our 9 to 5 clinical. We've got our clinical practice, our clinical training, our clinical practice, our clinical work, and then we've got uni. So it's just the juggle between 2 different diaries, 2 different schedules, and it's just making sure that we are focusing on both, giving both, the equal amount of attention, focus and effort, but at the same time trying to make sure that we're doing our best on both sides. So that's where the challenge is. So it's not just uni, going to university, going to lectures, studying in libraries. It's more than that. We have now, previously back then it was 2 days of uni. Now it's 1 day of uni. And then, yes, we do have what we call PBL, practice-based learning days, which are meant to be days where we focus on uni work. So it's like no work. It could be on one of the working days, but it's strictly for, focusing on uni work. But the thing is one thing is tough. It's just that, until now, it still is a struggle, but I think we'll get the hang of it. I think it'll take time. It's not something 1, 2, 3 months. I think this just takes some time. Maybe, hopefully, in maybe 4 months, 5 months, maybe by 6 months, hopefully we'll get our head around things. But things are getting slowly better. It's piling up. But anyway, with week 9, we were learning. I'm a big fan of, since uni, I was always a big fan of psychological detachment and the whole work-life balance, narrative, and the research behind it, the articles written about it, and the talks, how people speak about it. And there's so much to talk about, even in today's age, with people getting burnt out, people struggling, taking work with them at home, or etc. It's just a lot of mastering our time management as much as possible. So that's something I've just been reflecting about throughout that week, and even till today. With Monday on week 9, we continued on the lecture about generalized anxiety disorder and excessive worry. The treatment behind it, or the intervention that is focused here, is worry management. And in the previous video, in the previous episode, I spoke about hypothetical versus practical worries, which is what we actually went through here. And a lot of what is done, especially in the beginning part of the sessions, not only in worry management, but even in the others, graded exposure therapy, as well as behavioral activation, and the others, a lot of it is psychoeducation. Learning about our mental health. So not just the awareness side, but learning about psychoeducation is about learning about the condition that we are experiencing, learning about the problems that we are enduring and facing, learning about depression and low mood, learning about panic, learning about worries, learning about anxiety, learning about fear, learning about phobias, learning about sleep problems like insomnia, learning about all these different symptoms, understanding them and how they affect and impact our lives. How do they impact us socially, personally, professionally, our performance in other areas of life? How do they impact us? How do they impact our mood, our sleep, our appetite, and all these different areas, our day-to-day routines? So a lot of it, sometimes it's about understanding, I remember, one thing I do remember back in uni, and this really helped us to understand a lot of the mental health conditions, and that is what it is, brief description, the signs and symptoms, then we understand, and this is mainly in psychology, that in clinical psychology and abnormal psychology teaches us this a lot, and that is, understanding the causes. In the UK, for example, they call it etiology with an A. I think in the in the US and like that area of US, Canada, Northern America, they call it etiology with an E. But the idea is the causes of these particular disorders and conditions. What are the causes? What are the factors? And we get to understand that. So we're understanding the symptoms sometimes, the causes, what may have caused it. Most importantly, what goes on when we experience them. We're looking at our thoughts. So we're looking at something called the ABCEs. Okay, A is for autonomic. We're looking at our physical symptoms. The B is our behavior. The C is cognitions. So our thought process, our thoughts. And then we look at E, which is the emotions. We're looking at these areas, okay? We're looking at these different areas. We're looking at our, the situation. Sometimes we tend to call it the situational ABCE framework. What we can call it here is our thoughts, physical feelings, emotions, and behaviors. Sometimes we tend to call it a hot cross bun, all right? So looking at whenever a particular situation happens, what's going on, and how can we apply what we are feeling and experiencing in that. So that's what we do when we're working with clients. So learning about the worry diary, we were learning about, triggering situation. I mean, example, we get an email. So for people here who live, let's say in the UK or in London in particular, you get an email from London TfL, travel for London or London Transport, get an email about a strike coming up. How are you going to feel? Strike on a weekend and you've got plans, all right? You've got plans. You want to meet your friends, you want to meet family, you want to meet whoever, you want to travel outside London, you want to travel within London. You made plans, probably even for yourself. For those of you probably living outside the UK or outside London, it's like, you've made certain plans on the weekend, and then you've got, you get this unexpected, surprising, an email or a message from someone, and all of a sudden you're starting to worry and panic. How do you deal with that? How do you deal with that? So, for example, with the London TfL, there's a strike. You got a presentation to do at work. You begin to spiral in your head with worry about the worst case scenarios. What's gonna happen? What if this happens? What if that happens? And so on and so forth. So we delved in deep into that. We understood, the difference between practical and hypothetical worry. Explained that in the previous video, and it is achievable. It is. That's it all sounds. When we explain all these things, about all these different interventions, when you say them, it may sound easier, like it's easier said than done, but within time, it just needs effort. It sounds simple, but it is achievable. And the evidence for over 13 years, we're talking about 15 years now since the IAPT, the Improved Access for Psychological Therapies, this program, this service, ever since the service was launched and established for how many years now, it has been proven to show that these interventions, this service can lead to over 50% of recovery. And it is proven to do so up until this day. And you're looking at recovery not just from, we're looking at, it all started with face-to-face, and now it's expanding. We've got the digital therapies coming in, which is something that, is absolutely amazing. Digital therapies, learning about, the platform. So we work, let's say we've got the session-based and we've got now a platform-based. You have seen throughout, the research has been going on for a decade now, but you're seeing, especially post-pandemic, like with all the mental health issues that have been going on and all the rise of mental health disorders, the rise of mental health conditions, but we're seeing that the session-based still proving that one-to-one, that if, we can do things remotely. So there's the face-to-face where we could do things remotely. Then you have now platforms. You have online platforms. You've got so many different startups and applications that have proven. And what is shown is that success and recovery is possible. It takes a bit of time, but it is possible and you can be successful in that. So towards the end, we were learning about, the different relaxation training, such as present moment focus. We learned about the progressive muscle relaxation and all of that. And, it's just the week just went very quick, to be honest with you. At the end, they were just telling us about what we learned is that we've got our next tours, our next tour to observe a role play for treatment coming up, and some writing assignments and the exam and etc. And that was pretty much it for week 9. Let's check out week